Everyone, thank you for coming to Tap Talks. This is our first video that we have been streaming since we reached 100 subscribers, so thank you everyone. If you like and support what we do at any time, please consider hitting like and subscribe. It does help us with some computery stuff with YouTube. So free way to help and support us. So today we have a speech language pathologist, and I did have quite a few people ask me what that is, and you'll just have to wait, sit there and talk, and you will learn from Grace Hanna, who will tell you everything about it. So we're going to start with the presentation. Feel free to write all your questions and comments in the chat. We will come back to them at the end of the talk in order to answer all of them. So please feel free to put them in at any point. We are keeping track. So Grace Hanna, if you want to share your screen and introduce yourself, please.
Let's do it. Yes, my name is Grace Hanna. I'm a licensed speech language pathologist, also known as an SLP. So yes, what that means as a licensed SLP, I hold a master's degree in speech language pathology, and I work in home health with kids. So what I do is I go to kids' homes and provide speech therapy, as well as I diagnose and treat kids who have communication disorders. So this could be a communication disorder involving speech, such as articulation, like they have difficulty producing certain sounds. Maybe they're saying wabbit instead of rabbit, and I'm here to help make sure that they're producing these sounds correctly and setting up goals to meet those. And as well as we deal with language. So if they're having trouble comprehending language and following directions or understanding vocabulary, that is something that we'll work on, as well as I deal with cognition and swallowing. So with cognition, that could be memory, executive functioning, helping improve attention, and swallowing. Some kids, even adults, have difficulty swallowing, and that is something I address as well. I also work at a school, a private school, where every student has a communication disorder, and I'll take kids one by one and work with them privately. Another fun thing that I do, I just have a lot of different, tools, little trades here. I provide accent modification. And so what accent modification or accent reduction is I help to reduce accents for non-native English speakers who voluntarily come and see me so that they can reduce their accent, so that they can build confidence and they can speak more clearly. And yeah, and it's a really fun thing, and I really enjoy that. And thank you guys so much for having me. I can't wait to get more into this talk.
Yeah, this is fantastic. Thank you for the full explanation, because I know most of us didn't even know this field existed. So this is great. Thank you.
Awesome. Okay, I'm going to share my screen and we'll get into it. So once again, thank you guys so much for watching and participating. Let's do this. So the title of my talk is Keep Talking, I'm Diagnosing You. Life of an SLP, or speech language pathologist. So these are the two businesses I work for, Sonrisas Therapies, home health, and Capital School of Austin, that private school. So what do SLPs do? More than you think. So this is an example of working in a business scenario, helping with accent modification or accent reduction, helping improve and increase the confidence of the speakers who are maybe non-native. I also work with accent modification to help maybe give someone an accent. Let's say we've got an actor who wants to do a play or a movie, and they want to maybe get a good country accent, and they want it to be, on par with the actual Texas accent that they need. And I'm here to help, okay? I also do something called alternative augmentative communication assistance, and this is primarily for nonverbal speakers. And so they need another form of communicating, and they'll use this to do so. So I can also work with adults with cognition, helping with memory, and as well as swallowing. We've got a photo here. This is an example of vital stimulation therapy, where we use electrodes to stimulate those laryngeal muscles, those throat muscles, to help get a good strong swallow, as well as what we may know when we think of speech therapy or speech pathology, articulation, helping make sounds. So I feel like when I meet new people, they're always like, oh, my sister, she did speech therapy as a kid. And this is a lot of times what we think of when we think of speech therapy, articulation. Alrighty, and here we are, articulation. And this is, helping make those sounds that maybe kids are missing. Usually I work with kids with articulation. And so, yeah, making sure we're making a good, strong K sound. We'll isolate the sound, we'll put it into words, syllables, and eventually, hopefully, phrases, sentences, and then generalizing these sounds into conversation. I have an example here. The video is a little bit silly here, but we'll just give it a listen. And my patient here will demonstrate how we isolate the K sound in this example, and then move on to making it at the word level. So let's listen.
All right, we're going to make the K sound. Can you try making the K sound? Good work. All right. Can you say K?
Isolating the sound.
Key.
And now he's putting it at the syllable level.
Kai.
Ko.
Ko.
Ku.
Two.
Amazing. Let's start with our K sound in the beginning of words.
We'll start at the beginning of words, in all positions of
Let's
words.
move our trucks, monster trucks. That boy, what's he doing? He's
Carving.
good work. Alrighty.
So all I want to do is make him say the K sound. Any other sound isn't important to me.
Key.
Just one sound at a time.
Okay, now let's practice it.
So that shows you that. And guys, you may think articulation isn't, the end all be all, but guess what? Communication is important, all right? And that's how we express ourselves. It's vital to humanity to speak and effectively communicate. So there can be errors in our speech when we are not effectively producing the correct sound. And here is an example of that. We don't want to be cursing. So listen here.
Fish. Shit.
Fish. St.
So yeah, we definitely want fish sticks, not fish shits. Okay, my apologies for the cursing here of this child. So yeah, this is important for articulation. There you go, moving on. Okay, I also work with language. And one component of language is grammar. So we want to always have correct grammar. So I was doing group therapy recently with a few students, and one of my kids was like, "Oh, Billy, you is so stinky. You is so stinky." And of course I'm like, "No, we are not talking like that here. You are so stinky." Let's say it together. You are so stinky, Billy. Come on. So that is something that I focus on. Definitely important to have language and effectively communicate. So yeah, fun facts about language. Another component of language is pragmatics and use of language. So social anxiety, I help to address that, as well as just using language appropriately. One of my favorite parts of language therapy is turn-taking skills. That's always a fun goal for my young kids, is making sure that they're, using pragmatics appropriately and having effective turn-taking. But really, like, my favorite part about it is just dominating at Candyland and just like winning every time. Because, these kids need to have these, lessons. They need to let an adult, just crush them at something. So I enjoy that. So we also cover stuttering. Okay, so this is a type of fluency disorder. I don't know if you guys have seen the King's Speech, but King George VI, this is based on a true story of King George VI, who stuttered. He was a stutterer. And this guy right here, Lionel, from Australia, was his speech pathologist. And he helped him build confidence, smooth out his speech so that he was able to effectively speak to his nation. A fun fact that we may not even know is that our president, Joe Biden, stutters. And this is something maybe we don't know because it's very minimal. We don't always hear it. And we can thank a speech pathologist most likely for that, as well as his confidence and his amazingness. So yeah. So some facts about stuttering is that 1% of the world stutters, and about 5 to 10% of kids will stutter in their youth, and 80% of those kids will eventually no longer stutter by the end of their elementary school years. So yeah. As I had mentioned about accent modification, I do accent modification. It's super fun. And like I said, it's voluntary. It's a voluntary thing. This is not a disorder. There's no problem with the individual who decides to get accent modification. It's really just to help build their confidence and, reduce their accent to speak more clearly if they so want. So I will put on a role as a French speaker, a non-native English speaker and French descent and ancestry. And I will be saying this sentence before accent modification. So probably you are not understanding everything I'm saying. All right? Right here, we had trouble with those R sounds. So as an accent modifier, I will help address just one consonant sound at a time. So this consonant sound I'm addressing is the R. So let's go through it. I'll say, probably you are not understanding everything I am saying. Now I'll say it again after that accent modification. Probably you are not understanding everything I am saying. So which one was easier to understand? That first one or the one after? I'll give you guys food for thought, food for thought. All right, and then we've got Russian. Bears in Siberia are very scary. All right, so let's get into it. All right. For this, we want to have a long AIR sound, air. So that's one sound that we can address here. And we'll focus on that for this. Bears in Siberia are very scary. Put it a little bit slower. Bears in Siberia are very scary. Which one was easier? There you go. Just told you. All right. And here's one of my clients that I see. She's from Ukraine. And I want you guys to note difference in confidence from pre-accent modification to post-accent modification, as well as articulation differences, her pronunciation. Alrighty, let's listen to the first one.
Rainbow passage. When the sunlight strikes raindrops in the air, they act like a prism and form a rainbow. The rainbow is division of white light into many beautiful colors.
Alrighty, and then let's listen to her now. We'll notice a lot for that first one. There's a lot of ziza instead of th, as well as maybe confidence. Who knows? She was speaking kind of quick too. Let's listen here.
Rainbow passage. When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors.
Right, so hopefully you guys noticed somewhat of a difference and more clarity there.
Rainbow
Moving on. Ooh. Alrighty, another component of speech pathology is AAC. I love AAC. This is alternative augmentative communication. A lot of the kids that I work with use AAC in some way. This is for kids who are nonverbal. They are not speaking. And a lot of the parents that I come across are worried that their child will never speak, will never be able to express themselves. And it's very important that they communicate. And I very much love this because I have seen so many success stories with AAC. So as you'll see here, there's a communication board where they're able to answer yes and no questions. They can use a speech generating device like an iPad where they can point to items in sequence to tell, make full sentences. And this is the first, time for a lot of parents that they're seeing their children communicate. And a worry when I first start working with a kid when they're not talking of that parent is that they don't understand their family, that they maybe can barely identify any vocab words. And so that's a big deal. And so I really, really like AAC for that reason, because they're finally able to communicate, And this is called a speech generating device where they're able to click on icons and it'll say out the word. And so they can say I, and then go to love, and then people, mom, and press play, and it'll say, I love mom. And that's a way for them to communicate if they're not able to do it verbally. So my next slide, I'm going to show you a video of one of my patients who, when I first started working with him, I was presented with goals to work with him on identifying objects out of a field of 3. So for instance, if he had to identify the vocab word horse, I'd show him a tree, a picture of a tree, show him a picture of water and a picture of a horse. And I'd say, point to horse. And then he'd have to point to horse. So those were his vocab words. That was kind of where we were at on his goals. Slowly but surely realized that he can spell, he can read, And we got to a point where he is able to type on his notes to his iPad, as well as use a speech generating device like this to communicate. And he can write long essays. And I've had a lot of patients like this, and it's just profound and amazing, and I love it. All right, and here is Mr. Patient of mine. This is his mom showing what he wrote. She saved it.
Would be willing to make an Instagram page with his thoughts and his own quotes and conversations, and this is his reply.
I think I would be open to this, but only if people from my school couldn't see, because those little shits don't need to know.
I think we're seeing a pattern of shit in my presentation, so my apologies, but it's true.
Would be willing.
Okay. So another part of speech pathology is working with people who have had brain injuries. Because our brain is super important, and it's, definitely connected to our ability to speak, language, our voice, our cognition, all of this. Certain brain injuries that can occur that can affect our speech and our communication in general are strokes, traumatic brain injuries, tumors, surgical trauma, infection, and seizures. But don't worry, guys. I know this is tough. I know this is a lot to handle. No one wants any of these things, but a speech pathologist is here to help, okay? Always here. And so, yeah, we help with communication when these injuries occur. And these are the types of things that can be affected, like your balance, your vision, hearing, language, and all these things we would set up goals, diagnose, and address. But one thing that's not on here is swallowing, guys. We're getting sexy with swallowing. Swallowing, penetration, aspiration. Oh my. Just kidding, guys. This is serious stuff. All right. So don't joke. Thank you. So we've got dysphagia. Dysphagia means difficulty swallowing or not appropriately swallowing. And get your mind out of the gutter, guys. Penetration. What that is when you swallow food or drink. And penetration is a type of dysphagia where that food or drink is at the level of the vocal folds. Okay, not good. We want it in our esophagus, all right? So when we drink or eat food, we want all of that to go to our esophagus, and we have these lovely muscles that protect our voice box, our trachea, from it going down to our lungs. So penetration is when you have food or drink right at that vocal fold level, and it isn't going straight to the esophagus. Aspiration is when that food or drink is going through the trachea to our lungs. And that's how we can get pneumonia. And that's not good. We don't want that. All right. So I used to work at a hospital, and I provided a lot of bedside swallow evaluations. A fun fact about this is whenever there is an injury to the brain, stroke, TBI, all the things I had mentioned previously, all those patients are NPO. That means nothing by mouth. They're not allowed to eat or drink until a speech pathologist can get in there and make sure that they are safe to eat and drink. And we provide a bedside swallow evaluation, as well as we'll check for their cognition, attention, see if there's any other issues going on. If there seems to be issues with different consistencies of food they drink, we need to perform an MBS, a modified barium swallow study. It's like an X-ray video where we can see what's going on, what's happening, and if there is an issue with their swallow, okay? So guys, I want you to take a look at these 4 images, and I want you to tell me if you see any, like if one looks normal, if others don't, put it in the chat box. If there's one that looks specifically normal, not normal, what could be wrong? Okay, I'll let you know now. So A is a normal swallow. It's going straight from the mouth down to the esophagus. Here, we've got some just residual pooling right above. It's not going straight to the esophagus. So clearly the throat muscles are not strong enough to get it down to the esophagus. And that's a problem. We might need to change the consistency of their food to allow them to have a stronger swallow. Here, guys, this is called penetration, where it's the food or liquid is right above the vocal folds, and we don't want that. And right here, we've got aspiration, where it is well below the vocal folds into our trachea, into going down towards our lungs, which is not good. That can get infection, no good. So like I said, we can change the consistency of their food, their drink. We can thicken liquids to make it easier to manage so that there are no difficulties with that. And still, if that's a problem, we would give an NG tube through their nose, straight to their stomach, so that they are able to get the nourishment they need and not risk for choking or anything like that. We also can provide vital stimulation therapy. I am certified to provide that. What we do is we put electrodes on whatever muscle that appears weak to strengthen it. And this is, there's evidence to show that we can strengthen those muscles so that those muscles can work effectively to provide that strong swallow that we're after. Okay, guys, we're getting into the last topic here, neglect. Okay, and I'm not talking about neglecting to do your dishes or neglecting to do that big project for work. I'm talking about hemispatial and body neglect. So we have, whenever there's an injury to the brain, maybe one hemisphere of your brain is injured, you can get neglect. And let's go into that. You could get a hemispatial neglect, all right? So you make this beautiful Italian meal. You even get a recipe, you give it to your loved one, and they don't even finish it. My goodness, what's wrong with them? But for them, they feel like they just ate this whole plate. They are neglecting one side of their body, or not one side of their body for hemispatial, one side of their surrounding. So what they see here, they finish the plate, completely neglecting the left portion of their meal. If we were to turn that plate around, they'd be like, oh, a second serving. I've got a full plate here. So that's just it's just a fascinating thing. It's very interesting how complex our brain is to where it does this. And so speech pathologists would help with visual spacing and help them recognize, hey, there's something going on here. Let's fix it. And then there's this thing called body neglect, where they only see one part of their body visually, and they only seem to believe that one part of that they only actually have one part of their body, while the left side of their body they don't see as theirs. So if you were to get their left arm and they're neglecting that part of their body, you'd say, hey, whose arm is this? You'd be like, I don't know, it's not mine. So they're neglecting that part of their body. And that's something we would also work on. So yep. Thank you guys for listening to this talk. Really appreciate it. And I can't wait to answer all your questions. This is my Insta handle. If you guys have any questions, you can reach out to me here. Thank you guys.
Thank you. That was very enlightening. We have a lot of questions. I think you had to touch so many topics that I'm going to have to make you clarify a lot of more details on them. So I'm going to go a little bit backwards just because we just covered, also you're getting a bunch of claps and stuff in the chat as well at the moment. So do you know what causes the hemispatial or the neglect?
Yes, so it would be an injury to one hemisphere of the brain. We're still learning more about it, but it can just occur.
So yeah. It's usually in adults then that get it. It's not like a child just is born is like, I shouldn't have this arm.
No, typically it would occur from a stroke or an injury, but if a child had a traumatic brain injury, that could happen.
They could get it, of course.
Yeah, okay. That could happen at birth, having an injury at birth.
So another one is you had those x-rays of all the different like swelling issues.
Yes.
And how did you get those x-rays? I assume they had to have been choking or whatever while you were doing that.
No, there's a lot of great material online, so I pulled from there. But yeah, so but you're right. When I would go and do the modified barium swallow studies, those X-rays, we would go, to outside of the lab, and you could see it and you could stop it and take a photo from there.
Oh, okay. And actually, that leads into the next question of why barium in particular.
Okay, so barium is a non-toxic metal, and it is a metal, so it can be seen on that X-ray. So. Perfect to swallow.
Easy enough then. Thank you. So we have several questions on stuttering. One is, why do stutters particularly struggle with saying their own name? Several people we have do have stutters in the chat, and was wondering, is there a reason for that?
A lot of times stuttering can be linked to confidence. It's not specifically saying that it's just sort of a symptom. It doesn't mean, oh, I don't have a lot of confidence, therefore I have a stutter. It's just a symptom of that. So if you increase your confidence, so I think perhaps maybe if you're saying your name, it's just sort of, it's how you identify. And I'm not quite sure how to answer that, but I think that it defines you when you say your name, and that can, be linked to your identity as well as, stuttering being a part of your identity.
Gotcha. Okay. So are stutters linked or indicative of other disorders, or like mental disorders as well? Or is it its own thing?
It's its own thing. Of course, there can be concomitant factors, having stuttering as well as, other difficulties. And sometimes you're not born with stuttering. Sometimes you can get a stutter from having an injury to your brain. And of course, if that were to occur from a brain injury, there could be, of course, other factors.
Okay. So is usually SLPs working with stutters, is it usually with children, or does it end up being used a lot with adults as well?
You work with kids and adults, because, I even had a patient who was an adult who stuttered. And what we did was a lot of times when you're working with adults who stutter, it's just addressing it. And a lot of times we do on purpose stuttering, where we'll ask the kid or the adult to go and on purpose stutter. To just kind of get over that fear, be like, I stutter. It's who I am. No big deal. And if you can get over that fear, that iceberg, usually it can help you manage your stuttering, because what a lot of speech pathologists say is it is an iceberg. Like, you only see so much when a person stutters. You just see, oh, okay, they're having difficulty producing this sound without repetition. But there's so much anxiety that can be linked to that. Secondary factors such as, movement of the face or body that goes along with stuttering over a period of time. Yeah.
Is there a reason, so if it's like its own thing, why do some stutterers get stuck on particular letters or sounds rather than just equally occasionally sticking a stutter in?
Well, there are certain sounds that are just a little bit extra difficult to say. And it can be on an individual basis, right? So there can be certain triggering words or triggering sounds, and that can just be on an individual basis as well.
Okay. Sorry, we have so many questions here. We will get all y'all's questions, by the way, so please keep putting them in the chat. I will get to them. I'm just having to hop around a little to try to stay on a topic, just so everybody knows. So speaking of working with adults, you had the video of the Ukrainian lady who was reading the rainbow thing.
Yes.
How long does it usually take to get results that good?
About 3 months.
That's not bad.
In her case. But yeah, I mean, it can vary depending on, it's really, because it's voluntary, I just say, what do you want to work on? What's your biggest thing? Like, and I usually have like a screener of what's your confidence level when you're talking to someone in the grocery store, when you're talking to a friend, a stranger, these kinds of things, just to sense, what they want to get out of therapy. And that's our goal, whatever they want to get out of it.
All right. That was great. It was really nice for you to clarify, by the way, that it is voluntary for changing your accents and everything.
For sure. Yeah.
We love accents a lot of the time, but it makes sense that sometimes they can be a little bit difficult on certain
Yes. And I always tell her, I never want to get rid of your identity, because that's a part of your identity, your accent, where you come from. Just reduce it if that's what she's after.
Right. Absolutely. So then another question was, you spoke all the accents beautifully. How did you learn all the different accents?
I love accents. I'm a musical theater actress, and accents is sort of my specialty, if you will. I've got a good ear, and I just love doing accents, and it's important to me.
You've been doing that most of your life, just like every time you saw a movie with an accent, or?
Pretty much. I mean, I've just got to kind of get in my head, and I, go into different accents. It's just what I do.
I love that so much. So I did miss a question talking about the penetrative and aspirative dysphagia. If we can go back to that real quick. Is it possible for people with that to eventually develop enough swallowing strength to switch back to eating solid food?
Of course, yeah. And that's also, what the vital stimulation therapy can help with. There's compensatory strategies, like, hey, if we move our, if we move our head, maybe we can use, this right side is perfectly strong, but this left side is weak. So then our right side can, compensate for this left side that's weak. There's certain strategies, as well as sometimes it only can take like a week before it comes back. Okay. So I would go to the hospital, and there would be a patient who's had a stroke. I'd go in, they're slurring their words, they're having trouble orienting themselves. Maybe they don't even know their name, can't swallow, any sort of, consistency of food. The next day, it's like they're a whole new person. They know who they are. Their speech is back. That just shows how plastic our brain is, and the plasticity, and how we're able to be like, you know what, this stroke isn't getting me down. I'm coming right back. So I know this guy's, but yeah, so sometimes just because they're having swallowing difficulties that day, maybe the next day they'll get better. But that's not the case for everybody. And in those cases, we of course want to develop goals and keep them safe, giving them the right consistency of food and just help them strengthen those muscles, which can be done.
So you actually answered more, because this was a multi-part question. You answered a lot of it, but I do want to just touch up in case there's something else as well. One is like, how does one develop these conditions? I know you just said a stroke. If you come out of a coma, would you have to reteach your body how to swallow and stuff like that as well?
All right. So when you come out of a coma, a lot of times you're intubated, and boom, they take all that out, and boy, is your throat so, I don't know, roughed up. So that can be hard for swallowing. That can be hard for speaking. So you definitely want to wait a bit after that. But in regards to comas, yes, I mean, it really just depends on if there's still an injury to that part of the brain, because essentially what's happening when there's a swallowing difficulty, it's our signals. So we have signals that are sent to our throat muscles, the muscles in our throat, and to work, right? And if there is an issue, if there is a deficit or a trauma, that's going to, mess up our signal. And so the muscle's not going to be working correctly. So if they come out of that coma and there's still that deficit, that's still that injury that's affecting those muscles working properly, then yeah, you would have some issues there with your swallow.
Gotcha. So I will say, I was wondering, I was like, how are we out of questions? I was missing the second page. So we are going to go back in a circle again on different topics. Apologies on that.
Bring it back.
So do people, speech language pathologists, do they work with people with dementia as well? Because they struggle to communicate a lot.
Yes, of course. And for that, you really just want to maintain quality of life. Obviously we want to do a lot of restorative strategies to help, improve memory, but really it's mainly just maintaining good quality of life, helping them recognize their family members, and just keep them hopefully at a status of, being good, being strong.
Yes, I just feel so bad. We're going to have to go over everything. So one thing is, we talk about accents, and of course we're in Texas, we're all just kind of assuming everyone's going to want to get our accent, right? But do you ever have it where, besides like an actor trying to play a role, do Americans ever try to get a speech language pathologist to get a different accent?
Of course, yeah. I mean that. I've never seen it that way, where it's just like, you know what, I just want to change. I'm on the run. I've got to get a new accent. I've never seen that, but yeah, I guess you could technically, because really you could have like a dialect coach to help get an accent, and a lot of times actors use those people, but a speech pathologist is better because we're trained. I have a master's degree in understanding the voice and how it works, understanding vowels, understanding consonants. And that's how you get an accent. You change your vowels. You recognize what consonants are tricky in certain, areas, dialects, and do that. And that's how you're going to get the accent you want. And that's what I'm trained to do.
Are there speech language pathologists for sign languages?
Of course. Yeah. That's something I didn't touch on here. There's a lot of other stuff I didn't touch on that speech pathologists do, like vocal training, as well as working with the hearing impaired. So if there is a person who is hearing impaired, you can, of course, do sign language, and you can also, if you want, it really just depends exactly what they want to. If that person is hearing impaired or a big D deaf, they might tell you, hey, I want to lip read, or I want to be able to sign exact English. It's really whatever they want. But there's all sorts of techniques that speech pathologists can do to help that individual speak or use sign language. Yeah. I do sign language all the time. A lot of times with kids, I do sign language to help expand their language. It's usually a preliminary thing I do before I do like an augmentative communication, where I ask them to use a board. I'll be like, oh, what do you want? You want more? You want more to drink? Okay. So we do that kind of thing.
Awesome. So kids learn sign language easier than trying to teach them vocally, or even just the symbols on the board?
If they don't appear to speak, if they're not speaking they're clearly delayed in their speech, and it doesn't appear that they are just going right at speaking upon like my initial onset of therapy, I will be implementing sign so that they can at least start speaking basic things to get their needs met. And then from there, we've got a good base, basic needs are being met, and we can start expanding onto a communication board, and then hopefully eventually an iPad where they can do a speech generating device where they can put a sequence of words together to make sentences.
So for part of your degree plan or whatever, did you have to take sign language classes then? Is that just
I did not have to, but you can. That is a component you can do in undergrad.
Could you actually speak a little bit on what undergrad, so I assume the master's was all focused on speech language pathology. Was your undergrad as well, or is that something different?
Yeah, my undergrad was focused on speech language pathology. I also did a lot on linguistics. That was important, as well as like phonological, processing, like IPA, the International Phonetic Alphabet. So that was a lot of my undergrad, is understanding all the different sounds and being able to read and write in IPA, which, it's literally the sounds.
Is that what they use in courtrooms with their cute little like miniature typewriters? It's just
possibly. I know I'm classically trained in singing, and if you want to do other songs like in other languages, they always have it in IPA and the phonetic alphabet, so that you can sing in German or Italian and be able to know the sounds that you're supposed to make.
That's actually really cool. I had no idea. I didn't know that existed.
I know. I've got like my little it's a whole nother language type thing.
You have so many fun facts. That's amazing.
Yeah. I know, guys.
So one second. So the tablet you were talking about, I'm trying to find, what impact has technology like those tablets had on the field? Because that's got to be a fairly new thing.
I mean, of course, yeah. I mean, we would use communication boards like in the 1940s, things like this. I mean, we just had communication boards, or little like felt that we would stick on and try to communicate that way. So it just made things like the access so much better, more quick, and it honestly, it's so intuitive. I have noticed it's so intuitive for these kids that I work with. Like the parents are like, wait, what do I do? And even me, I'm like, wait, how do I navigate? And they're like, I want to go. That was like one of the first things. Like, you can tell I'm a great speech therapist, because when I give my patient just the other day, she just started using a speech generating device. I give her the device, and first thing she's like, goodbye, I want to go. And I'm like, she just figured that out. Like, I just gave it to her. She loves me, obviously. So yeah. So, I mean, she just knew that, right? I didn't even have to teach her anything. She went straight to it. So yeah, it's really quite amazing. And as you guys can probably tell, I love AAC, especially now with just the access we have.
Yeah, it sounds like so much. So if we can go back to swallowing real quick, can severe anxiety cause swallowing issues?
Yeah. Well? Yeah, so there's a thing called spasmodic dysphonia, or there's other things where if you have like severe stress, your vocal folds, maybe you can't phonate. Like sometimes you can't even phonate. Like, so when you speak, these are your beautiful vocal folds here. When we talk, they're moving really fast and vibrating together. And sometimes it's open and you just can't speak, or you feel like you can't breathe. And if like they're open, if your vocal folds are open and the muscles are not helping you close, what's going to happen? Food might just go in there, right? And you might be having some swallowing difficulties. While there may be nothing anatomically wrong with your muscles, there may be, somehow your own brain, your anxiety from your brain or stress is causing you to maybe not have your vocal folds close. So that could cause you.
So would you also be the one they would go to fix that, or would they just have to go and get the anxiety fixed?
No, I've got my counselor hat on here. Who knew I have a psychology degree too? No, but no, I don't have a psychology degree, but we are trained in counseling and just helping calm and use different strategies for calming and breath support. That's a lot of what we would do in both stuttering as well as with anxiety for swallowing.
Gotcha.
Yeah, just breathing and just calming strategies.
So going with anxiety as well, so related to stuttering, you had mentioned that the anxiety confidence can make a difference. And it does seem to make sense. However, in some social environments, like where you're with your family, you're 100% comfortable.
Yeah.
Why are you still stuttering then?
It happens. I mean, I even had a parent just recently be like, this last 2 weeks, he was stuttering so much. And, we just had the time off. We were with family. I don't know what's going on. I mean, stress can cause stuttering. Being around family members who are asking extra from you, extra speaking, that can cause stuttering. But sometimes it's just an ebb and flow. Sometimes you're stuttering more. Sometimes you're stuttering less. Sometimes you're like, oh wait, I stutter. I forgot, I mean, but other times you're like, oh my gosh. And it's just, some days are like that. And that's just what I hear from, clients who stutter. It's just the way. Sometimes it's extra tough, and sometimes you don't even notice. You're like, I'm speaking great.
Gotcha. Okay. So we have a couple more. One second. Let's do this one because it's fun. There's a couple others as well. But so do astronauts need swallow training because they're going to have different gravity and everything? So
oh my gosh, I didn't even think about that. Well, I like the thought there. I guess they need to probably, when they do their little space missions at NASA, eat some astronaut food and see if they're having any issues or coughing. Get an SLP over there right away.
Yeah, it'd be fun if they're having issues. Tell them just send you up there, right?
I know. I have to go. I mean, that makes sense, right?
Okay, we do have a couple more that I missed. So what is the ultimate accent? I don't know the background of this question. Or maybe what is your favorite accent?
My favorite accent is the French accent. I speak French and I just love the French accent. It's my favorite accent. I do not know why. The south of France is especially close to my heart. So they have a more laid back sort of French accent, a lot more slower. Love it.
So before we started, you had actually spoken to me individually about going to France. Can you tell us a little bit how you learned?
Yes. How did I learn French? Well, guys, this is the way to do it. All right. Take notes. I would I drink 2 glasses of wine before my French classes. Of course, that's the way to. And there's understanding behind that. I've taken some linguistics courses. So how babies develop language so quickly is that they are able to just take little bits of information and make sense of it, right? As adults, when we try to learn a language, sometimes it's really tough because we're trying to get like all these sentences and make sense of it in our brain. But if we bring our minds back to a baby stage, we're able to acquire language so much more easily. And that's effectively what I was doing with these 2 glasses of wine. I was bringing myself back to a baby stage, able to, get little bits of words a lot more easier, as well as my inhibition was, I guess, free. And I wasn't nervous or, caring really how I sounded. And so I was able to learn French a lot easier.
I like that strategy. I do that every night. I just forget to go to the French classes.
That's exactly right, guys. You have to do it.
So have you ever done, one second, I need to know how to pronounce this. So the swallowing thing. Have you ever done a dysphagia sympathy day where you only do thickened liquids?
I want to understand that. So where I only do thickened liquids, say that again?
I'm assuming there is a dysphagia sympathy day, and I think they're just asking if you observe it.
Oh, they're saying, so like, if I just drink thickened liquids I should do that, guys. Thank you so much for being people, human friends. Thank you. I will definitely look that up, and because honestly, it's no fun. It sounds like some of the foods that they provide, like, it looks kind of gross, and it is because it's completely changing the consistency of the food. And sometimes you do thicket. I don't want to take any thicket off the shelves, and I recommend you people don't do it either, because it's not good. That thicket is for people who have swallowing difficulties.
So it's basically just blended food, right? So can't you just teach people to chew better?
So if they're having oral musculature issues, if they're having trouble, so there's certain parts of our swallow, there's like 3 or 4 components that go into it. So if you're having trouble moving your food around in your mouth, that's one part. But if that's fine, but you're having trouble with your laryngeal part of your muscles, there's nothing you can do. You can help them chew better. You can do little facial muscle exercises. Chewing's not going to help them.
Gotcha.
So I have a story from one of my professors. He's my favorite professor. He taught my dysphagia course in grad school, and he was from the South Texas. And there's a guy who really, really loved Oreos. Nothing wrong with his mouth, nothing wrong with like the oral structure, but he was never able to swallow because he didn't have that trigger mechanism in the back of his throat. He wasn't able to move that bolus, move the food back to get a strong swallow. And so he was my teacher, as he explained it. You can chew that Oreo all you want, but you're never going to be able to swallow. As he's like wipes a tear away, because it's serious business.
Yeah.
But yeah, like eventually every bit of that Oreo, with the saliva that he was generating from chewing would come out onto his napkin. So you really just have to address what the deficit is. Is it the oral structure, the mouth, that's causing you not to be able to move the food around? Is it like the laryngeal point? Is it more towards the laryngeal esophageal or pharyngeal esophageal? There's a lot of different things like that you got to focus on to help get a good strong swallow.
Gotcha. It makes sense. There is a whole degree on it, so it makes sense. It's not as simple as chew your food enough times.
But you can certainly strengthen that if that is just the issue. I mean, you would hope. You never hope for any sort of dysphagia, but if it's just an oral thing, then let's strengthen those muscles, and that would be great.
Gotcha. Okay. 1 second. I'm just gonna read this. So I know that they used to sever the brain hemispheres to treat seizures, and something similar to neglect happens. Are there overlapping studies?
I would have to look up and get more info on that, but yeah. So sometimes with seizures, one part of the brain is sending so many signals to the other hemisphere that it is just causing a lot more seizures, right? And that is what seizures are, right? They're moving from one side to the next. And kind of the last thing you want to do, the last thing you're going to do to really kind of treat the seizures would be to cut the hemispheres, right? That's never really a good go-to thing, to cut your hemispheres. But when you do that, you are helping prevent more seizures, reducing that. But you do have to relearn a lot of things, right? Because essentially one part of your brain is no longer talking, both parts are not talking eventually to the other. And sometimes with this, you might, I'm trying to think, you could say you could tell, so you have a dominant hemisphere typically. Sometimes it's the left, sometimes it's the right. And so most likely it's your right. And you could be talking to someone and say, all right, I want you to touch your toes, or I'm trying to remember, but sometimes you'll find that your left hemisphere is doing stuff, maybe your left hand is moving and you're like, what is my hand doing? You almost don't even feel like it's yours. So yeah, there's a dissociative kind of body neglect that can occur. But yeah, it's interesting.
So there's different levels of neglect. I think I hadn't realized that. I was thinking it was just, nope, you just assume half your body doesn't exist.
Oh yeah, no, there's definitely, thank you for saying that. There's levels of neglect, for sure. Gotcha. With both the body as well as your spatial surroundings.
So how would you help someone with Tourette's?
That's a great question. I have never worked with anybody who has Tourette's, but to my knowledge, from what I have studied, it would just be calming. I would think just calming strategies might benefit them. I wish I knew more on Tourette syndrome. I really do.
I guess that means it's probably not, well, you're already saying, I don't know, but it's
I don't know. I'm so sorry. It is literally, I just remember reading one little paragraph in a textbook, which is, something that, I think we all, should hold ourselves accountable as, medical professionals to get continuing education courses to help patients who have Tourette's, because it is a part of communication, and it is, a valuable thing to address.
So I think, if anyone else has more questions, please put them in the chat. One of our last questions is, what is the most difficult accent to work with?
I mean, they're all different. I don't know if I mean, they're all different. I don't know if I feel comfortable answering that. Yeah, they're all different.
Okay. So there's one more question that I think might have been asked at the beginning, but if you don't mind going over it again, what strategies would you use when working with a child who stutters, stuttering specifically?
Yeah, I mean, if first, is the child aware that they stutter? Because it's kind of if they're not aware, you don't really want to bring it to their attention, because if they are not aware, then it usually goes away on its own. Okay. Like I had mentioned, 80% of kids eventually stop stuttering. And what can get stuttering to become worse is having like, I'm just going to throw parents under the bus, having parents or teachers or kids poke fun, like, you stutter, like, make fun and kind of just stress them out or say, hey, you're stuttering, let's work on that. And just, making it very, in their mind. And that can build stress, that can make it worse. That can, exacerbate the problem. So yeah,
I will say, I know I did ask a kid in kindergarten, because I still remember, because I felt that afterwards, but I did immediately ask, like, why he stuttered, as if, again, I was 5 or 6, but I that's one of those things where I could see it's very important to make sure that children also are not just constantly pointing out things that are different, right? Definitely,
yes. But if they are aware, to note that if they are aware of their stutter, just let them know, hey, it ain't no big thing, like, that's cool. Some people stutter, 10% of kids will stutter. You're fine. You're just one of those 10%. It's not a big deal. Like, let's talk about it, stuttering, and just give them facts, kind of just like empower them with their knowledge, maybe give them information to present with their class, so that, you aren't asking these questions and they can get ahead of it and empower their class to know a little bit more. They feel good. They strengthen their confidence with it. And, those are the best techniques, just smoothing out their speech, good breath support, things like that are good. I like breath. Just take a nice big breath before you speak. And of course, there's different strategies depending on the type of stuttering, because there are different types of stuttering. And there's quite a few different strategies. And you would just ask the kid, hey, what strategy do you like the best?
Oh, nice. Okay. So actually letting the children have a little bit of say in there.
They should. So yeah.
They are people. We just forget that.
I want.
All right. So what causes individuals to pronounce and sound out certain letters of the what causes individuals to mispronounce and sound out certain letters of the alphabet?
So if you're just having articulation difficulties and not pronouncing sounds correctly, so there can be an articulation disorder, or just articulation disorder, where they are not making their sounds. They're delayed. So that doesn't mean, that's what I mean to say, articulation delay. So there's no disorder. There's no issue in the brain. You're just delayed. Sometimes it takes us longer to swim or ride a bike. And for some kids, it's that way. So there's certain milestones that kids reach when they make their sounds. You're not going to expect a 2-year-old to be able to say their ch sound or or these types of things. That's not expected. Okay. They don't usually get that until they're 5 years old. So if they're not hitting those typical milestones, that's when a speech pathologist comes in to help give them those sounds and help them make those sounds. And that's just in their brain if they're not making those sounds. But we're here to help address, like, hey, what's going on and how can we help you make the sounds? And sometimes they're just not as aware of their mouth positioning and like what they need to do to make those sounds. Maybe they're not hearing as well. You definitely want to see if they're hearing, their vision is intact and beautiful before we really get into articulation, because we want that to be taken care of before we go into that. But then there's also a thing called a phonological processing disorder, where they're making sounds that are not typical in any case, right? It's not a delay. For instance, if you're fronting, like you're saying tat for cat, that's not a typical thing. We don't ever really see in any sort of kid, whether they're delayed or just typically developing. So with that, that's just a processing of those sounds that just neurologically is different about their brain. And we want to help them notice, hey, I am saying ta for cup in the beginning of words. I should fix that. Let's fix that. And how can I do that, Miss Speech Pathologist? Here's how. And then they do it.
Does there seem to be a correlation with children that have that like misunderstanding of the sound and being able to read? So, or does
yeah, totally. Mm-hmm. So that's a phonological, processing disorder. So if you are not recognizing those phonemes, those sounds, that can also translate to the symbol of the letter. It also goes really like hand in hand very often, like with comprehension sometimes. So obviously, and just like dyslexia in general. So you want to be able to understand the sound, like hear the sound, recognize the symbol. Okay, so ta, oh, that's the letter T. All right. And this is how I make that sound, ta. All that goes hand in hand. That's just a part of the processing of auditory information. So yeah, very often it's all together.
Nice. So is selective mutism in kids something you work with?
So for those who don't know what selective mutism is, it's a child who, or an adult sometimes, who is selectively choosing when to talk and not talk. Sometimes they don't talk at all. There's nothing wrong with them neurologically. This is usually brought on by anxiety, fear, stress. And, for instance, like, I've had one kid where, like, in their class, I'm like literally just tooting my own horn, but in their class, they're not speaking, okay? They're barely talking to their parents, but then in speech therapy, somehow they're like, okay, I'll talk to you. But it takes time, trust is built. But yeah, it's just comfort. And sometimes kids just need extra time before they start talking. So yeah.
So is stuttering into adulthood often paired with other cognitive disorders? So you said it's pretty common in children to have stuttering, but if it does stay that 10% or whatever that it does stick with, is that another neurological disorder?
I mean, of course, with anything, there can be a concomitant disorder, but that doesn't necessarily mean that they're going to. And in most cases, there's no other, communication deficit other than having a fluency disorder such as stuttering.
So what causes mispronunciation of letters in only specific words? So most of the time they can pronounce the R or something, but then in some words they can't.
That's interesting. So sometimes they can pronounce the R's, but they're not always making those R's. I mean, that can happen. They either learn the word wrong and they just don't know how to say it with that R and they don't realize they need to. But sometimes, like, if they're just learning a new sound, they can, sometimes they'll make the R sound, sometimes they won't. I've got a kid who I'm trying to get him to make a tuh sound at the end of every word. He will always make the tuh sound at the end of the word goat or float, but I can't get him. And that could maybe be because it's a long O sound. O, goat. It's easier to make that tuh sound. But other words, maybe it's a little more tricky. Like when he says cat, that ah, it's hard to get from an ah to a t. So he just wants to, drop that last sound. Maybe that could be a reason. I wouldn't really know until I saw the kid.
Okay, yeah. Different things for different people.
Yeah.
Awesome. So I will send you to read the chat afterward. You have lots of people thanking you and all, bunch of shout outs. It's very
Thank you guys. Thank you for watching and participating. Great questions.
If you don't mind, could you flash your Instagram again, please? I don't know if you got a chance to put that in the chat so that everyone could follow it.
Please.
All right, so we had a few people who asked me about this. Her Instagram is at Grace Voice of Austin. She is in Austin, but hopefully once we're back in person, maybe she'll come around and be in DFW for a bit.
For sure. And if you guys have any, questions about maybe family members who you're like, hey, they're kind of delayed in speaking, or my, mom's having trouble with their cognitive skills, please reach out to a speech language pathologist or schedule a neuropsych evaluation to just check that out.
Awesome. I very much appreciate you being here. I appreciate all the people who have come and watched this talk. Again, if you support and like what we do to help us reach more people, please consider just hitting like and subscribe. It's a free way to greatly help our movement get forward. We just want to get science out to everyone who can and normalize it in society. So thank you everyone again for coming, and y'all have a great night, great weekend. Bye-bye.
Thank you.